So what we're trying to do with participation screening is trying to identify those people who have known cardiac, pulmonary, or metabolic disease, abbreviated CPM, because they're at greatest risk for an exercise-related cardiac event. It's going to adopt the AACVPR, so that's the American Association for Cardiovascular and Pulmonary Rehab guidelines. And then also we're going to support the public health message that all people should try to become as active as possible and adopt an active lifestyle. So look for presence, signs, symptoms, or risk factors of various diseases. Again, cardiac, pulmonary, metabolic, CPM, as well as other conditions that might require a person to contact their doctor before beginning an exercise program. We want to have safety during exercise testing, and we want to be able to develop an optimal exercise program for them. So if you look at this table here, the signs and symptoms suggestive of CPM, well, of course, people getting chest pain or angina equivalent, and as we said, it may not necessarily be the typical crushing chest pain as we talked about with the classes on heart disease and atherosclerosis. We talked the other day in the pulmonary class, shortness of breath with mild exertion at rest. So unusual shortness of breath, dizziness or syncope, fainting, orthopnea or paroxysmal nocturnal dyspnea. Remember we talked about that in the pulmonary class too. Ankle edema, again, may or may not indicate presence of disease. Palpitations or tachycardia. As we mentioned in class, an occasional PVC can be normal, but if a person is having a lot of irregular beats, they may need to get that checked out. Intermittent claudication. Claudication is blocked arteries in the legs. So if you have clients that are saying, I'm getting these really bad calf cramps when I exercise, they may need to get that checked out. They can have blocked arteries in their legs. Heart murmurs. Again, heart murmurs can be normal. They can indicate heart disease. So if the person doesn't know that they have a heart murmur and that it's something that they need to be checked out by a doctor, they may need to be referred. And as we mentioned, unusual fatigue or shortness of breath with usual activities. Extreme fatigue. So once again, we're trying to identify people that may not be able to exercise. Maybe they've got a condition that is not stable right now where they're not able to exercise, and who may need to go into a supervised exercise program versus a community-based program, such as things that we might have at the West Center or at the Y. And so what they call is self-guided materials. That's your PAR-Q. So looking at your self-reported medical history and your health risk appraisal, that is the minimum screening. Or looking at another type of screening questionnaire. Whatever you use in your client situation, you want to be able to pick up these cardiac risk factors or any other things such as orthopedic limitations that might require them to check with their physician. But the PAR-Q is the most common. And here it is. So it was developed by the Canadian Society of Exercise Physiology, and that's why it's csep.ca, because it's Canadian. So that is the minimum entry screening for an exercise program. You probably also want to do a medical history questionnaire. For research purposes, we usually have to do an informed consent. You may need to develop a physician approval form that you can send to the physician to allow the client to be in the program, and then a HIPAA privacy form. If you're needing to access people's medical records, and that can sometimes happen in some of the research projects we have in this department, such like with athletic trainers, and they may need to also sign a HIPAA form. So the HIPAA privacy, it's all to ensure participant safety and confidentiality in an exercise program.